I'm joined by Gavin Yamey, a professor of public health and public policy at Duke University in the United States. Thank you for joining us on France 24. We just heard from an official at the World Health Organization there. We are very much in the thick of it, in the midst of things with the coronavirus. You have argued that there is something of a cycle of panic and neglect when it comes to governments and organizations fighting these kinds of pandemics. Can you explain that for us a little bit?
Well, that's right. I mean, this is obviously a time for global compassion and global solidarity. And my thoughts are clearly with patients, their families, those who've lost loved ones and the carers. What I have argued is that in many ways, we have seen this before. There have been previous outbreaks. SARS, for example, in 2003, Ebola in West Africa in 2014 to 2016. And every time that has happened, we have scrambled. There has been panic, understandably, and the international community and donors and funders have managed to inject cash very quickly. But then what happens is, after the outbreak is under control, and obviously I hope that happens very quickly with COVID-19, the funders, the donors, the international community, we move on to other things and we neglect pandemic preparedness. There are cycles of panic and neglect. In many ways, global public health suffers from what you could call a kind of out of sight, out of mind paradox. Once a disease is out of sight, we sort of forget about it. We've seen this, for example, with malaria in the past. Many countries have managed to bring malaria under control. They don't see very many malaria cases, and so they stop funding malaria programs only for the disease to resurge again. And what I would argue, and what my colleagues and I have argued in a recent study, is what we really need to do is to build a proper global pandemic preparedness system that is truly fit for purpose. We know that there are going to be outbreaks again in the future. We have seen this cycle, and we have never really invested the kinds of money that are required to build a proper system, a system that has medicines, vaccines, and diagnostic tools that can control outbreaks, a system that has the ability to surge. What do I mean by that? Surge health workers, surge vaccines, surge vaccine manufacturing. There are so many things we need to be able to do that we are not doing.
Well, is that not the function of the World Health Organization? Would you say they are not doing their job properly?
Well, that's a fantastic question. And I think that the international community needs to adequately fund the WHO. This is part of the WHO's core mandate and core responsibilities. One of the problems is that we as an international community, we as countries or member states who are members of the WHO, we have done a very poor job of funding the WHO. In some ways, we've kind of starved them of the funding that they need to be able to manage, to coordinate, to lead on outbreak preparedness. And that is part of the problem. Yes, we need to adequately fund the World Health Organization to do its job properly. And we need to make sure that we have a whole host of things in place, stockpiles of protective equipment, for example, and so on, so that when these outbreaks happen, we have a system that is ready to go. Health workers, spare health workers, if you like, surge health workers.
Okay, if I could just jump in, if I could just jump in, if I could just jump in, because we are running out of time. I just want to ask you about specifically with China then, because it was China that seemed to say it wanted to deal with containing this virus by itself. It didn't ask for the World Health Organization to get involved. And in fact, it took the WHO a month to declare the virus a global health emergency. So isn't it the case that some countries would prefer to deal with these things on their own without that level of international cooperation?
My sense is that this is definitely not the time for finger pointing or for trying to understand who did what or said what and the timing. It's a time for global compassion and global solidarity. There are so many things that we as international community could be doing better. in terms of generating knowledge, sharing knowledge, surging funding, surging expertise, and having a system in place of connectedness that allows an outbreak anywhere. It allows the global community to respond together, because an outbreak anywhere is an outbreak everywhere. These are risks that we all face. They don't stop at national boundaries. And so we have a collective responsibility to address them together. And I personally am a very big proponent of a compulsory global tax that all countries should pay, perhaps a carbon tax or something like that, to build the kind of global pandemic preparedness system that is needed to, for once and for all, break these cycles of panic and neglect.
Okay, Professor Yamey, thank you very much indeed.
Thanks for the opportunity.